So good morning everybody, lovely to see you all today. I think Alice has given me a fair introduction. I'll move quickly on to the talk. There's a lot for us to cover in this session. I'm going to skim over lots of different topics. Hopefully there's something that you will connect with and that means something to you, and there will be an opportunity for questions at the end, but I'll also be around over the lunch break if anyone wants to catch up at that point as well. There may be something you think, oh, that's not so relevant to me. That's fine, and hopefully there'll be something in it that does impact you as well. Specifically in the talk, we're going to talk about emotional responses to cancer. Obviously, it's a physical illness with physical treatments, but I think you'll all agree that there's an emotional response we have to that as well. We will look at some of those flashpoints where there's more distress. We'll talk about grief and loss, and depression and anxiety. We'll also spend a little bit of time talking about relationships, and I'll touch on the psychosexual concerns, though there's not a lot of time to come into that today. But I also want to weave through all of what we're talking about and specifically focus at the end of the session about some tips and ways to cope. There's lots of things that you can do to support yourself, and there's also times where you might want to flag up that you need additional support from other professionals. And that's what we'll look at throughout the talk as well. Okay, so, reaction. I think you'll all agree that it is an emotional thing going through a cancer diagnosis and treatment. It's not something that we can mostly just brush off. Some people manage to do that, but I think this illustration of an emotional roller coaster is what a lot of people describe to me in the sessions that I do. There's highs and lows, it's not all down. There's times when you feel quite buoyant and it's exhilarating, but there's also times of real fear and real stress as well. And those twists and turns and that sense of not quite knowing where you're going can be very unsettling to us emotionally. And so I think it's really important to say at this point, there's no right reaction. Everyone's different. I'm not here to tell you how to react. I'm not here to tell you how you should do it. But that recognition that it can affect us all, and that's okay. But sometimes we need to attend to the emotional side as well as the physical side in order to get through the best that we possibly can as well. So if I was to ask you, how are you feeling? It suddenly becomes a very big question, I think, when you've got cancer, doesn't it? I mean, it's the sort of question mostly we just say, oh yes, I'm fine too, don't we? And we brush on, especially as British people. But I think suddenly when you've got a cancer diagnosis, it really does become a very big question, and one that's quite hard to know, even in yourself, how to respond to. So maybe some more pertinent things. I'm not going to go around the room, I'm sure we could do, but we don't have time. To think about for yourself as you're thinking about this session. What does cancer mean to you? How does it affect your life, either now or how has it affected your life? And how do you feel about cancer right now? How are you feeling in yourself? And sometimes I ask my question, clients, how are you today? Which sometimes is a more manageable question to think about than how are you, whatever. So that's important for you sometimes to check in with yourself. And I would include all of you that are relatives and friends and partners as well, because this is something that affects you equally as well as the person actually going through the treatment. So I've listed here, this actual list came from a workshop that was done with health professionals in terms of what they had observed in the people they were working with. The variety of emotions, and again I think if I was to go around the room today and ask you to say one emotion that you'd experienced, probably some of these things would come up, probably most of them. You might have experienced quite a number of them as well, and obviously they're very varied. Sometimes we're really pleased that we've got through that bit of treatment, or we've had a good test result. At other times we feel angry or frightened or scared, not sure where we're going, and that sense of kind of quite pessimistic about the future as well. So that real roller coaster actually is. And again, I think it's really important to say there's no right reaction. Sometimes we frame emotions very much in terms of positive and negative. I find that's not very helpful mostly for most of the people I work with. They're all emotions, aren't they? And they're all things which are quite reactions which are quite to be expected. It's something about how do we respond to that feeling that we're having. So if we're angry, how do we respond to being angry? Where do we show that anger? What do we do with it? That makes a big difference, and sometimes that's an important thing. You notice the emotion, but think about, how do I respond to that? How do I actually react to that? And that's something that we'll look at as time goes on. I also think it's important to recognise that we cope differently. We're all different, and at different times we cope differently as well. So this is a spectrum, the mental health spectrum that we talk about. And for some people, we have that shock diagnosis, and then quite quickly we get into that frame of mind that we can just get on with it, and we're determined, and we're going to get through treatment. And we somehow make that adjustment. We're making adjustments all the time as human beings, aren't we? We're quite resilient. And that might be something that you feel like you can do for a period of time. For a lot of the people I meet, there is a real period of adjustment, that sense of, how do I cope in this point? And that sense that things are all up in the air for a while, and you're in a new landscape. You don't quite know what to expect in terms of the treatment plan or in terms of how you're actually going to be feeling, never mind the future. And that sense of that everything's disrupted, and that might show itself in terms of some physical symptoms. You might not be sleeping very well, you might feel quite irritable with the people around you, or you might feel like you can't do the normal things that you would do. But at some point you find that you're adjusting to the new landscape, and you find yourself back in a space where you think, well, it's not ideal, but I can cope, and that sense of you coping. And that might be at different points in the journey, and then you might go back, or you might go to a point where you're more struggling as well, and you think everything's up in the air. You really feel like you're not doing very well. You might notice other symptoms. You might notice that you're very anxious about things. You might become anxious about the people around you, for example, as well. And that sense of either struggling, or even for some people, will become quite unwell psychologically as well. And we will go on to look at some of that in a moment as well. But I think it's the sense that actually, that sense that we can move on this spectrum as well. And actually one of the things we can do with ourselves is check in, where am I up to? Am I actually adjusting, and that's okay? Or do I feel like I'm really not actually coping very well, and actually I'm struggling, or I'm feeling really unwell emotionally, and do I need some more support? Thank you. So sometimes that is tied in with what we call distress flashpoints. So these are times where our distress is heightened. So one example that's often used is around scans or test results, for example. So that sense of actually not just having the scan, but waiting for the results. I think many people identify that that is a particularly stressful time. And so somehow our emotional distress is exacerbated at those points. And it's how do we cope with that? But that might also be about, unfortunately, recurrence, or even the end of treatment, or that sense of that there is no more treatment options around as well. So I think it's useful to recognise that these are points which might be particularly hard for you, and that helps us think about how do we cope with that psychological impact as well. And obviously that might mean different things for different people. So some people really want someone with them at the appointment when they're getting results. Other people's choice is to go on their own at that point, and that's thinking about what actually works for you in that situation. It can be helpful. Okay, and obviously, that can be a secular thing as well. I mean, the ripple effect of cancer can be quite significant, can't it? The impact on your daily life. For many people, they're surprised, I think, how much the ripple effect of cancer can be, whether that's family life, relationships. It might affect your working life, or the hobbies and interests you had. For some people it's a spiritual or faith challenge as well. And that recognition that all of those things can be impacted as well. I think again it's about acknowledging that, but then thinking about, what do I want to do about that? How can I support myself, or how can I seek support in those situations as well? So just to summarise this a little bit, in terms of the impact on your well-being, I think what I do really want to say as well is that I find lots of people actually surprise themselves how well they do adjust. There's some difficult messages in this talk, but it's certainly not all difficult. There's some optimism as well. And though cancer can have a big impact on your well-being, I think that sense of adjustment and resilience that many of us are able to show within that time actually comes to the fore. And for a lot of people, they say, oh, cancer's brought this for me as well as it's taken this as well. So the impact on our wellbeing can be wide-ranging. It can be related to the physical, the pain or the actual impact of treatment. Hormone treatments can be difficult sometimes, can't they? It can be about experiencing the emotions and actually that sense of vulnerability that comes with being a patient. The loss of control, and sometimes things like sleep and the fatigue that we feel around either treatment or after surgery can have a big impact on how we're feeling as well. It can be mood changes. How we feel about our bodies can change as well, and that can impact on how we're feeling. As we said, relationships. And then some of the fears that come as well, the sort of what-ifs that can play on our mind as well. And thinking about the future as well and what that brings. So I'm just briefly going to touch on some of the more significant psychological impacts as well. And this is really about giving you some sense of being aware, really, so that you're looking out for things. And you might think, oh, this isn't to do with me, or you might think I've noticed that in someone I know. Okay, so the first bit is about loss and grief, and I think there's many losses that come with cancer. That might be around actually someone's death and dying, but it may be another loss. For example, it may be about loss of a job or loss of being able to work in the same way. For some people, it might be about loss of fertility. And I think that acknowledgement that goes with that loss is that actually a lot of emotions come up, and that sense of grieving can come around those losses as well. There's lots of different models about grief. If anyone's ever looked at that, you'll know that that's the case. This is called the grief wheel. I quite like it because you're there in the centre. You'll notice the self is in the centre. And that sense that it's not a linear thing. You can be touching on various different parts of this at the same time. But there's a lot of quite difficult emotions that come up, and my experience with loss and grief with clients is there is no real avoiding it. I think it's back to what we were talking about in the previous session. There's something about we have to feel the feelings, even when they're challenging sometimes. But there is that sense of movement as well, and that actually life can continue, albeit it might look a bit different to how it did before as well. Okay. So for many people, this is something that happens naturally, that adjustment to loss. If that's something that you feel like you're struggling with, then there might be an opportunity to seek more professional support as well. Just going to briefly touch on depression and anxiety, because we know from research that cancer patients experience a higher incidence of depression and anxiety than we would normally expect in the population. So it's not a given that that will happen, but it's also something that we shouldn't ignore. So these are some of the symptoms that we might see, and we might notice it in our loved one if we might not be able to see it so well in ourselves. And we would always say if these things happen for over a month and aren't associated particularly with a physical condition, then it's worth checking it out. It's something that we shouldn't sort of anticipate or expect or just think, oh, well, that's just how it is. It's something that we should pay attention to as well. So it may be that it's necessary to flag it up with your healthcare professional. It may be that it's something that your GP can support you with as well. We all will have bad days, that's okay. There's something about this depression is more when it carries on for a long time, and something that you feel you just can't dig yourself out from those feelings of feeling very flat or feeling very low in mood. You can't be bothered to do things. You feel quite irritable with the people around you, or you feel sad a lot of the time as well, and that needs attention. Okay. And similarly with anxiety, I think being anxious is almost an expected part, isn't it, of having those tests or results or whatever as well. And I think probably if I ask most of you, you will have experienced, whether it's to do with cancer or another time, some of the symptoms that are up here on this slide. When we're under threat as human beings, then the fight or flight response, which I'm sure most of you will have heard of, is a very natural response. So that desire to either run away or to fight is a very normal physical reaction, hormonal reaction in our body as well. The thing that also happens is that we have that same reaction if we perceive there to be a threat. So if we're worried about something, then the same reaction can happen in our body. And so there are physical symptoms of racing heartbeat or shortness of breath. You only have to think about maybe a time when you've been for an interview or something. It's not really a threat, but we feel a bit exposed, don't we then? And we can feel that sweaty palms type situation as well. So again, it's a normal reaction, but there's something about when that reaction almost is in overdrive. And for some people around anxiety, that can happen. So that might be if you, for example, found yourself checking symptoms quite excessively. So I once had a client who said to me that they were, every time they had a little twinge, they were on Dr. Google looking things up. And my question to them was, does that actually help? And of course, the answer was no. I think they actually said never, which was interesting, and yet it was something that they still did. So there's something about, a bit of anxiety is understandable, isn't it? When that anxiety leads us either into feeling these symptoms all the time, or to behaviours which actually exacerbate that anxiety, don't help, then that's when it's important to look at. And again, that might be something, if that's a problem for you, about getting more support. Okay. So moving on now to just think a little bit about relationships, because I think relationships are so important in our lives generally, but there's something that get into that intensity after a cancer diagnosis as well. And I think many people have really loving support and family and friends around them, but sometimes it's a time when tensions come as well, and we always experience relationships in the context of what we've already had. They don't just suddenly become wonderful if they've not been that case before cancer. And sometimes that sense of people don't always step up in the way that you expect, and you can feel a bit disappointed or let down, can also be the case as well. And I think the whole range of things can come into that as well. So bringing relationships into focus, which often cancer does with lots of bits of our life, can be quite a painful thing for some people, and can be difficult to manage as well. It sounds an obvious thing to say, but communication is the key, and we'll come on to look at that a little bit more later. I think, and also a recognition that the person that you want to care for you, or who's caring for you, they're experiencing cancer too, but it may be their experiences, it will be different to you. You're not going through it in exactly the same way, and trying to gain some understanding of that can be helpful. And thinking about, how you feel about the people around you, that can be difficult too in terms of the impact. So lots of things can come up there. Maybe your role changes as well. Maybe you've always been the person that's looked after everyone in your family, and suddenly you're the one that needs to be looked after. Those things can be difficult adjustment as well. So there can be lots of challenges. I think, again, it's acknowledgement that we can do something about these, that if we can acknowledge it, that we can actually attend to it as well. Okay. So this is, we said at the beginning we were just going to very briefly touch on the psychosexual concerns. The reason I put this in this talk, because it's really another whole talk, is that often it's an area that gets missed in terms of the psychological impact on us. And our sexual relationships are a really important part of our lives, and part of our own well-being, aren't they, and part of our partner's well-being as well. And inevitably, cancer can be a big disruption to that, whether that's particularly around, surgery or physical well-being, you don't feel like it, but also in terms of how you feel about yourself as well. So just on this slide here is some of the things that people identify that can actually challenge their sexual relationships. Sometimes this is something that you can talk about with your partner. Sometimes it's something that you need to pick up with a healthcare professional. It might be about looking at what medications impact are having, or even things like lubricants and whatever, and you can get some advice about that. Sometimes it's about actually you need some relationship or psychosexual therapy, and talking to a trained professional who understands that can be important, and that's something that you can flag up with your healthcare professional or your GP as well. Okay. So we've been flagging up some ways to seek help and support, but I just want to focus on that for the last bit of this talk as well, because I think though there's times where we do need that additional support from a professional, there's often lots of things that you can seek to do to support yourself, and I'm sure there's many things that you've already done or already doing. You've come today, that's very much part of it as well. But I've just highlighted a few tips and strategies that I've come and that patients have told me have been really helpful. So, how do we find a way to adjust and cope and move forward? That sense of how do we find a way to live with what has changed? How do we find a way to live with uncertainty? And that sense of living in the present moment. I'm very pleased to see you've got a mindfulness session at the end of today, and if you're able to stay for that, that's amazing. But sometimes that is a challenge because we actually really, when we think about it, we don't live in the present very much. We live in the past, or we live in the what if's going to happen in the future quite a lot. So actually helping yourself to live in the moment, which often isn't as difficult, you know, that's okay. I'm here, I'm okay at the moment. And many patients say cancer brings into focus what matters for them. But are we actually focusing on the things that matter to us? Are we actually spending our time and our energies, especially when that's limited, on those things? So finding out how to do that can be helpful. And a sense of taking back some control. I think, especially initially, a cancer diagnosis feels like it takes all your control away. You're told when to come for appointments, you're told when to be here, to do this, and whatever as well, and what's going to happen. Something about, in the midst of that, taking back some control for yourself can be really empowering, and that sense of actually, well, I can't do that, but I can decide about this, and looking for those ways that mean something to you. So, how to cope? I mean, there's lots of suggestions on this slide, some of which you might think, oh, that doesn't touch the mark. Some of that might mean something more to you. I've talked a bit, I'm a counsellor, I'm going to say about talking to people, aren't I? But that is sometimes something that's easier said than done, isn't it? You know, talking to someone else about how you're feeling. And some people love to talk, and some people find that much more difficult, or certainly find it more difficult about themselves. I think the evidence I have from working with many clients is that it really does help to talk to someone, and that might be someone close to you, that might be someone that you know well, who knows you well, that might be someone actually that steps up at that time, or someone that you know who's gone through something similar, who you find that you can relate to. It might be someone in a support group or whatever who's gone through a similar experience. But there also might be times it's appropriate to seek out professional help. I think the advantage I see in the counselling room is at that point it's just about the person that sat with me as well. They don't have to worry about how I feel or what's happening to me, which might be different if it's a member of your family that you're with or whatever. You're concerned about their experiences and feelings as well. So there's time where that separate space can be useful, but that's certainly not the only time that you can talk to someone. And I think actually thinking about who those people are that you've got that actually you want to confide in, and that you want to share your experience. And there's something about that. We all know if we felt we've lightened the load, don't we? If we felt we can offload a bit as well. So that's something to do. I think sometimes people think they're protecting the people around them if they don't say about it. They just keep it to themselves and sort of soldier on. And sometimes that works for a time, but often people find it just becomes too much, that burden, and it is helpful to offload. And usually the people around you know that you're struggling anyway, and at least if you're talking about it, you can actually talk directly about something. Do ask for information. So I'm just going to go through a couple more things on that one. Yeah. Do ask for information. I think sometimes people get quite distressed or anxious because they don't have the information. So that might be about thinking about writing your list for your next appointment. That might be about thinking about how do you engage your GP in your support. It might be about who's your clinical nurse specialist or your cancer care coordinator that can help you as well. But do ask for information, particularly if you're worried about something, because I think we can do a lot of the what ifs, but actually if we've got information, then we're using, and it's, you know, it's information about your situation, isn't it? Not just general sometimes as well. Being physically active, there's loads and loads of evidence. I think most of us know if we're physically active we feel a bit better. There's loads of evidence to say whether that's pre-surgery, post-surgery, during treatment, after treatment, that can be really helpful. Obviously, you've got to tailor it to whatever you're able to do at that time, and sometimes that is adjusting what you would have done before or starting doing something differently. But I think most of us feel a little bit better if we've been out for a walk or whatever as well, and I think it's using those things to know what helps you. Setting goals and making plans, I'll talk about this again in a minute, but I think being realistic about what you can achieve, but having some goals, whether that's for the particular day or this week or this month or before the next appointment, that can be really helpful as well, and make them realistic. I mean, you know, as I think Victoria said earlier, if anyone wants to jump out of a plane, amazing. But if you don't want to do that, which probably 95% of us don't want to do that, you know, that's not expected and not going to be helpful for a lot of people as well. What is realistic for you? You know, is a walk around the block actually realistic? And that's a good thing to do then, isn't it? And certainly building some relaxation into your day, that sense of actually how do I look after myself? And the opposite of the fight or flight response is that sense of relaxation. You can't be in both states at once. So actually developing some ways to relax, whether that's about learning breathing techniques, learning some relaxation or mindfulness techniques, can be so helpful as well. And back to seeking help if we need to. That's what go on. Living with uncertainty, I think, is something that a lot of people say troubles them, and that's the sort of thing that can keep us awake at night. Don't know what's going to happen in the future and whatever. And you know, there's no magic answer here, is there? But there's a sense of how do I learn to cope with that uncertainty in my life. And this is just a little technique that is useful for some people, called the stop technique. It's that sense of actually when those thoughts come, actually can I stop and actually sort of take a step back, think what am I thinking about, and if it's the what if this happens and this happens, it's you know, you can't go 20 steps down. We don't do that in life normally. We can't do that in a cancer treatment as well. So can I take a step back? That sense of taking a breath, again, that sort of like, can I just slow down a little bit at this moment? And then look about what is actually happening. What is the worry that I've got? Is it something that I can do something about? Is it something about actually I can find out more information about it? Is it something that actually I can't do much about and I need to understand that as well? And so gaining some perspective, and that might be when talking to other people comes in, because different people can have different perspectives as well. And I don't know what you see when you see this picture. Maybe you're focused very much on the sky in the middle, maybe you're focused on the buildings, maybe you're wondering what on earth is that picture, do you know what I mean, and what's the perspective as well. So sometimes that sense of like, you know, when I was sat over there in this room, my perspective is very different when I'm sat here. So just can I actually just change that a little bit on what's happening in order to help me cope better at this particular point as well. And it takes practice. I don't think anyone suddenly thinks, right, I've got this sussed. You know, there's something about it takes practice to learn different ways to cope and find out what helps you at these difficult times. Thank you. This is another sort of tip, strategy, which some people find helpful, called worry time. Has anyone heard of worry time? Yeah, no, okay. So the purpose of worry time is a way of helping you to manage those worries, those little niggles that pop up all the time and steal your sense of peace or keep you awake in the night or whatever as well. So the idea here is that every time a worry comes up, you think, right, I'm not going to actually deal with this worry now. And we do what we call postpone the worry. So we actually put it to one side, okay? And that sense of like, I'll come back to you later. And then we actually give ourselves a specific time. Usually I suggest to people, find a 10-15 minute slot, not just before you go to bed, maybe, you know, late afternoon when you can sit down with a cup of tea, something like that. And actually, that's your time when you're allowed to worry, okay? And sometimes you find you can't think, what was it I was worrying about anyway? And the worries somehow. Sometimes you've either made a note or those things come back to you, and that is your time for actually thinking, how am I going to cope with that worry? Okay. So what can I do about it? And it's a more practical way of actually dealing with it rather than the thoughts going round and round in your head. And of course there'll be some things we can't do something about. We can't know the future, we can't know what's going to happen on Tuesday, never mind in the future. So there's something about how do I let go of those worries. And I often talk to people about things, there's tips, if I put my worry on a leaf and let it go down the river, where would it go? I don't know, it's gone, do you know what I mean? That sense of actually, how do I physically think about letting go of that worry and focusing on what I can do so that I'm maximising my time and my energies on things that I actually can impact as well. And so actually using a sort of more problem-solving technique to think about what can I do about this worry. So that might be, I've got 5 questions that I need to ask the consultant on Tuesday at the appointment. Do you know what I mean? It might be, actually, I want to go and see that friend that I've not seen for ages, and I always feel better when I've actually seen that person as well. And so there's something about actually moving your attention to things that you can do as well. And obviously, then it's important to go and do it. I think within that 10-15 minutes, it's useful to come up with one thing that you're going to actually take away from that time. So you feel more proactive, more sense of actual, I can do this as well. And I always say to people at the end of your worry time, your specific time that you're allowed to worry, go and do something nice. Go and do something that isn't about worrying. Okay, so that might be make a cup of tea. That might be go for a walk around the block if that does you good. It might be cuddle the dog or whatever, okay? It might be actually, I don't know, go and run, do your 20-mile run or whatever you like doing, whatever suits you at that point. But have a specific end to that worry time, otherwise it's easy to take those thoughts into it as well. And if you get in a habit, again it's a bit about practice, if you get in a habit of that, then people often find that instead of spending that whole life on that your whole time on that edge, you're actually managing your worries better and feeling like you're coping more. Okay. Thank you. I was pleased to see this is something Simone talked about earlier about in terms of self-compassion. I think we can be really hard on ourselves, particularly as ladies, shall I say. We have high expectations of ourselves, and I think thinking about how you can be kind to yourself whilst you're going through treatment or recovering from treatment or actually coping with whatever the future might bring can be helpful. So I've just put some questions up here for you to think about, and this might be something you want to take away from today. What brings you joy? Are you focusing your time on things that bring you joy? How do you recharge your batteries? What actually gives you energy? For some people that might be being with others. For some people it might be time on your own. So there's no prescribed, this is the answer here. It's thinking about what actually works for me and what helps me. Sometimes thinking, what did I used to do that was good for myself and support myself can be helpful, because we lose track a bit of things when we're going through treatment, I think, and we sort of, people describe that sense of losing yourself a bit, really. So what did I used to do? Maybe you used to be the social butterfly and you haven't been able to be out before. Maybe you did used to run marathons and now you just think that's absolutely not going to happen, but what do I need to do that taps into that part of myself that I do enjoy as well? And I think it's that sense of what works on a bad day as well. So as we said earlier, everybody will have low days or bad days or days when it's more difficult to cope. Do you know what helps you on those days? And are you able to access that on those days as well? Because I think sometimes we can just think, just got to keep going. And actually, maybe it's okay to have a down day from time to time. All being said, if that continues, then as we said before, we need to pay attention. But certainly in terms of actually paying attention to that, what helps you on a bad day? Maybe there's somebody you always want to ring on that day. Maybe there's something about you do want an hour on your own and you need to just tell the people around you that you need that. Okay. And that comes back to the realistic goals and plans that we've already mentioned. Okay. The essence here is it's okay to be kind to yourself. And really that sense of adjustment and hope, this just is a summarising slide to say, if you can't do something, there will be a sense of loss, but maybe you can consider what was important about that activity. So somebody who's not able to work in the same way, maybe you're always working with people. How do you keep that connection with people? Maybe there's something else you can do, volunteering, or just making sure you are with family and friends all the time. Can you do it differently? And that does help us to adjust, and we're really good at adjusting. We sometimes just don't realise that we can do it, and that can give us hope as well. Okay. So I said I'd give a few tips about communication. Again, this could be a whole talk as well, so please forgive me for rushing through. And some of it might seem fairly obvious, but I guess if you really thought about a conversation, you thought that went really well, I feel so much better after that conversation, or a conversation where you thought, oh gosh, I don't feel great now, it didn't help me at all, then some of these things might have bearing. For those of you that are family and friends, this might be something to think about as well when you're talking to the person that your loved one that's got cancer as well. How do you make time for that communication? And that's hard. We all live busy lives, don't we? You actually sit down and make eye contact with that person. Do I literally, or are we just watching the telly and it's kind of like, all those screens and this, that and the other going on as well? Do I actually listen and allow the person to tell the story? I think being able to say what's actually happening, your own experiences can be so helpful. And how do you actually listen to that person? And check that you really do understand. So say, is this what you meant? Or actually, I think you were saying this to me, is that right? Sort of thing. Can be really empowering for that person in terms of them feeling understood. Use open questions. So, that sense of kind of, tell me about what happened today at your appointment is better than, did it go okay? Yes or no. That's not very helpful, but tell me about what happened. Use those open questions. And don't assume that you know how the other person's feeling. This is, something for all communication, isn't it? We're quick to assume that we know how someone is. And actually, we really need to allow them to tell us in their own experience as well. And don't hijack the conversation with your own experiences or feelings. So how many times have you told someone about your cancer experience and they jump in with, oh, my aunt, my grandmother, my mother had this, that and the other as well. And that's absolutely valid, but it's probably not the moment to actually share that. At that point, it's about you, isn't it, as well? Allow the other person to seek their own solutions, don't try to solve it. Actually, most of us don't want to be told and don't need to be told what to do. We want to work that out for ourselves, but sometimes that talking about it can help to do that. And summarising the conversation to prove you've heard and understood can be really helpful as well. Okay. So those are the things that all of us can probably work on in every conversation we have, but maybe particularly pertinent in this situation as well. And this is just about when you as a patient are talking to other people about your cancer as well, and just really try to emphasise this with people, that it is good to be open and honest in terms of, I think some people either think they're protecting others by hiding or they're protecting themselves as well, and sometimes that might be all right for a while, but it can trip you up a bit. So being able to say genuinely how you are can be much more helpful as well. But that being said, choosing who and when you say your experience is really important as well. It is your information, isn't it? And it is about what's happening to you. And there might be people you really want to know everything about what's going, but there will be people on the periphery that you only want to know something. So I think it is perfectly okay to give yourself a get out clause. There's just a couple of things that you are up there that you can do as well. Often I talk to clients about, for example, if they are returning to work, what they want colleagues to know, and then maybe one or two people that do know stuff, but they don't want everybody to know everything about their treatment as well. So sometimes that preparing, practicing with someone else can be helpful, and thinking about, I don't actually have to tell everyone everything, but you need to know this much about it as well. And the last bit is really important, because very often if you want the conversation to move on, a really good way is to say, oh, tell me about what's been happening to you, and just shift the thing as well, so that you don't Because sometimes it's overwhelming, isn't it? I had one client who very regularly got upset when she was talking about her cancer, and she didn't want to do that with anyone and everybody. And so we really explored how she could move the conversation onto the other person or move it onto a subject that she felt much safer talking about. And that didn't stop her talking to the people she wanted to about what was happening to her at that point. So, last but by no means least, I just wanted to say something specifically to those of you that are family and friends. I'm sure many of you there'll have been bits you've been able to pick up as we've gone on. But I think it is really about recognising what a challenge it is for yourselves as well. You know, it's a very hard thing going through cancer treatment, but it's also hard on those people around you too as well. Maintaining and developing helpful communication, so working out what does help for the person that you're caring for with cancer. What do they want to know? What do you need to know? And how do you show? So having some sort of agreement between you can be really helpful. But understanding that you will be coming from different perspectives, and different perspectives at different points of the journey as well. Quite often once people are diagnosed, they've almost got to the point they've kind of got an inkling about it, they've got a recognition. But that might be a complete shock to their partner or the person close to them as well. They might not have been aware quite so much what was going on. So there can be a different perspective at that point in terms of where you're ready to go. And that can happen at different points as well. And being prepared to sort of talk about that different perspective, try and understand the other person's can be really helpful as well. And if necessary, it's entirely appropriate to seek help and support for yourself as well. And there is often groups for carers or groups for partners as well, or opportunities for counselling as well if that's appropriate. So I've just put up this slide, and this is a sort of snapshot of some places that you can go to for help. You're obviously all aware of Ovacome in terms of and the support that can be offered, and things like support groups, and that can be really helpful for some people. Many of you will probably be aware of Maggie centres. They tend to be based at some of the big cancer support centres. I know there's one at the Christie, very near the Christie in Manchester, if any of you are associated with that. And a lot of hospitals have Macmillan Cancer Information and Support Centres as well, and their role is about connecting cancer patients and relatives up with the support that they need. So that might be they can offer you emotional support there, or they can connect you up with other services or other charities as well. And do tap into the expertise of the clinical team that's supporting you as well, particularly clinical nurse specialists and cancer care coordinators. Again, part of their role is to support you emotionally and to link you with specific support that can be helpful as well. And of course I've just put about GPs and counselling at the bottom as well. Okay. So, next steps. How are you feeling now? Is it still a very big question? Probably. Okay. But just give you a moment, reflect on all of the information and tips that we've shared out in what is a very quick whiz through, unaware. Is there something that stood out for you? Is there something that you want to take away? Maybe you want to go back to those 3 questions I asked you at the beginning. What does cancer mean for you? How is it affecting you now? How do you feel at this moment? Okay. And maybe there's something you think, I need to do something about that, or actually that's the area I need support with, or actually that's the bit I want to go and talk with somebody that I care about as well. And that sense of being able to look after your emotional well-being alongside all of the other things you've got to do with treatment as well. It's a tall order, but it certainly is a benefit. Thank you very much for your time. Thank you.